If you make this mistake before the NCLEX, you will fail and you won't even see it coming. Right. I have coached thousands of students preparing for the NCLEX, RNs, right? I've coached RNs, LPNs, right? Students who score have high scores in nursing school, right? Students who are straight A, students, repeat test takers, and almost every single one of them made this one mistake. Now, it's a mistake, right, that does not show up in your question bank. No matter how good with your question bank, you will not see this mistake. Your nursing school did not even prepare you for it. And by the time most people realize it, right, they already failed the exam. Right? Because when students come to me, the one thing I do is to ask them, they say, "Oh, coach, I want you to help me to pass the exam." So I ask them, okay, are you taking it for the first time or you failed the exam? Oh, I failed. All right. Have you gotten your test report? Most of them will say, yes, I have the test report. Send it to me. Now, when I evaluate the test report and I see you have like near or below the passing standard related to management of care or coordinated care, now I start suspecting what? This particular area, right? And I start suspecting this one mistake. Now, when I put student on Zoom and I'm like, okay, I want you to approach this question, I want to see if you are making that same mistake. And I'm telling you, almost every single one of them made this one mistake, right? So it's not about missing content. Most students will say, is it because I did not study a particular content for the exam? No, it's not the hours you put into studying. Most people will say, okay, is it that I did not study enough? No, right? It's about your brain doing the exact wrong thing when it think it's doing the right thing, right? That's it. Now, I have seen this mistake destroy confidence, right? Ruin your time, right? Create the kind of second guessing that leads straight to failing. I'm telling you, most students second guess why due to this mistake, right? Which lead them to what? To fail. And unless you break this pattern, because it's a pattern, right? You are walking into the NCLEX with a loaded gun. Listen to me. You are walking into the NCLEX with a loaded gun pointed at your license. So imagine you have a loaded gun pointed at your license due to this mistake. It means that you are not ready to get your license. So you need to fix what? This mistake. Now, let me show you exactly what I mean, right? I want you to look at this particular question. But before you look at this question, now I want to do something. Now I want to do something real quick. Let me take off uh, the information in front of this condition. Let's do something real quick. You are going to see, right? I'm going to expose the mistake now. So let me take off this. Now I'm going to test to see. You are going to see, right? You have that same mistake too, right? Because I said almost everybody have the same mistake. So I've been able to take off everything. Now we have option one, option two, option three. Right. This is the condition, this is the condition, this is the condition, this is the condition. So now based on this condition, who will be your priority? Your priority, right? Because the question is a prioritization question, by the way. It's asking you to prioritize who are you going to see first, access first. Now, based on the condition, let's not talk about what the patient is experiencing, right? Let's just focus on the condition. Who is going to be your priority? We have a patient who have heart failure, Crohn's disease, low platelet, COPD, right? Low platelet, that's regional enteritis. We have idiopathic thrombocytopenia, purpura, right? That's also low platelet. Now, if I am guessing right, because this is what I've seen over the years of coaching students preparing for the NCLEX exam, your answer is between 3 and 4, and I'm going to prove that to you. Why? Because most students always used to use this ABC. Right. So they will say, oh, this is cardiovascular, this is related to GI, this is related to cardiovascular, and this is related to airway or breathing because it's a respiratory problem, right? So it's only respiratory problem that can have airway or breathing problem, and then you have cardiovascular. And always, people always used to say, airway come first. So definitely you're going to say, this is going to be your answer, right? So your answer is either between 3 and 4. I'm going to tell you why you are saying 4 is your answer, right? Which I said right now because you are thinking about airway breathing. So you are saying 4 is your answer. Now, another most students as well too will say 4, but they are still between 3 as well too, because they can say, oh, this is low platelet. In their mindset, they are like, oh, low platelet can put a patient at risk for bleeding. So because of that, they want to prioritize that patient as well too. So they will be thinking about this. For this, they will say, okay, this is not even related to airway breathing circulation, which is for this. And then for this, they will say heart failure, this patient is stable, right? Because they will say, okay, comparing heart failure to low platelet, they will say this patient is at risk for bleeding. So that bleeding is what they are thinking about. This is airway or breathing, this respiratory problem, they are thinking about that. So you are with between what 3 and 4 based on the condition. Now, let me tell you the truth. You'll find out that yes, truly, I am between this condition. Now, let me tell you something. The moment you are thinking about the condition in any NCLEX question, so this is the mistake right now. The moment you are thinking about the condition in NCLEX question, you are not going to be able to prioritize right on the exam, because you will not become what? This is the mistake right now. You will not become an emotional thinker. NCLEX don't want you to be an emotional thinker. NCLEX want you to follow a certain pattern, which is the pattern that matches the NCLEX way of thinking, because you are all about who is the sickest client, not who goes by your emotion. Because your emotion is like, oh, this patient is at risk for bleeding. Oh, I need to save this patient. So now, because of this way, because you are thinking this way, right? You are like, oh, the answer can be 3. Now, because of this is also airway, and you are used to a respiratory problem, and you're used to ABC, you are also saying the answer can be 4. Now, that is what most students do. They judge the condition first before they look at what the patient is experiencing. So the moment they see what the patient is experiencing, what the patient is experiencing, they are trying to fit it into the condition. They are trying to fit it to the condition. They are trying to fit it into the condition, right? They are trying to fit it to the condition. That's what they do. So when you are trying to fit it into the condition, no matter what another answer is saying, you will still be stuck with 3 and 4. And I've seen this all the time. Now, that is the reason why the NCLEX don't want you to use diagnosis to prioritize. Diagnosis is not the reason why you are prioritizing on the NCLEX exam. You are prioritizing related to what the patient is experiencing. Right? You are prioritizing related to what the patient is experiencing, not based on the diagnosis. So when you are answering NCLEX prioritization question, right, you need to deal with what the patient is experiencing. Now, let me take this off. I will clean off the diagnosis, right? I'll clean up the diagnosis now, and I'll focus on just what the patient is experiencing, because that's what you need to do. Now, let me take off this diagnosis right now. Let me take off this diagnosis right now. Let me take this off. Let me take this off. Right, let me take this off, and let me take this off. Right, so now I've taken everything off, right? So now we are left with what the patient is experiencing, because you can see who, as, who, who. So now it means that they are telling you the patient condition, and they are telling you what they are experiencing alongside with the condition. So we are dealing with what the patient is experiencing. Now let me show you what the NCLEX wants you to know, so that you know NCLEX is not magic. Right, you need to have what you need to have in order to pass the NCLEX exam. Now let me show you what you need to know. Now, NCLEX wants you to understand acute condition and chronic condition. NCLEX wants you to understand these two things. Like NCLEX wants you to know different acute condition and chronic condition. So for every acute and chronic condition you are knowing, NCLEX wants you to know the definition. NCLEX wants you to know the pathophysiology. Right. NCLEX wants you to know the pathophysiology. So that's what NCLEX wants you to know about any acute and chronic condition. So immediately you see a particular condition on the exam, right? Take for instance heart failure, right? You need to be able to remember what the definition and the pathophysiology, because that is what NCLEX is testing you on, related to how you are going to think. Based on the definition and pathophysiology, NCLEX will test you related to that, so that you can start thinking accordingly, right? Let me recap. NCLEX wants you to know the definition and pathophysiology for any acute or chronic condition. Right. So once you know it, right, the question you are going to be getting on the exam will be related to what you understand about that condition and the pathophysiology you understand about that condition. That's what NCLEX wants to test you. That's how NCLEX wants you to think. Now, also, NCLEX want you to know side effects. Sorry, I said side effects. Sign and symptom and abnormal finding. They are not the same thing. A particular student was asking me, if sign and symptom and abnormal finding are the same thing. No, they are not the same thing. Abnormal finding is what the nurse will carry out an assessment to see that is going wrong, right? Now, sign and symptom might just be the patient presentation. You can easily see that the patient is showing something like this, but you need to get abnormal finding. You need to carry out assessment. So that's the difference between sign and symptom. Yes, some people will say they are closely related, something like that. Yes, true, they are closely related, but the main purpose of abnormal finding is when a nurse, how do you really get abnormal findings? When the nurse carry out a certain assessment. Now, so this is what I have in my coaching program, right? I make you understand the disease condition that you need to know for the exam related to the definition and the pathophysiology. I also make you understand the 10 body system, because when you understand the 10 body system, I'm trying to drive you through how you can answer question, right? When I make you understand the 10 body system, right, we know sign and symptom related to each of these 10 body system, and we also know NCLEX want you to know how to do head to toe physical assessment, meaning you know how to assess from head to toe. They call it physical assessment, also known as comprehensive assessment. Yes, NCLEX want you to know how to do everything, so that when it's time for you to do your focus assessment is where because you know how to assess every of the body system now, but NCLEX is not focusing on every of the body system. Let us say in a particular question they are only just focusing on heart failure, so you need to do focus assessment on what? Cardiovascular. You get what I'm saying? But if you don't know the whole head to toe assessment, how would you be able to know cardiovascular? Right, because you need to know everything so that you can be able to apply focus assessment on the NCLEX exam. You see, NCLEX has given us everything we need to know in order to answer question on the exam. It's not that we are just stuck with a particular way of studying that is not even helping us to pass the exam. That's why we keep failing the exam. Many students come to me, I failed the exam 7 times, 8 times, 6 times, 5 times, 4 times, 3 times, 14 times, right? And when I do these little changes, telling them a new way to study, it should not even be a new way to study. I just change their old way of studying, give them the real way for them to study, and they're able to pass the exam successfully, right? Just this thing, because this thing cover everything because 70% of your exam is related to the client, the client, right? Taking care of the client, making sure the client is stable, fixing the client physiological problem, right? That is 70% of the exam. 30% of the exam is the ethical part of nursing, where you deal with confidentiality, privacy, client right, client need, all that kind of stuff, right? But we want to focus on the 70%, right? And this will make up the 70%, right? The 70%, right? Let me clean so I make it neat. Right, let me take this off. Right. Now see, listen to me. This is what you need to know. Now, you want to know your disease condition, right? Your disease condition. Now, for your disease condition, NCLEX wants you to know the definition. NCLEX wants you to know the pathophysiology. So I'm just going to put it like that. Now, NCLEX wants you to know the 10 body system. NCLEX wants you to know your head to toe physical assessment. From there, you can now be able to do your focus assessment. Right. So now for the body system, NCLEX wants you to know sign and symptom related to each, and NCLEX wants you to know abnormal findings. Right, abnormal findings. Right, from the abnormal finding, you want to know the intervention related to those sign and symptom and abnormal findings as well too. So interventions related to both. Right, now your focus assessment is going to make you know abnormal findings. So now, once you know all these things, NCLEX wants you to know your vital sign. NCLEX wants you to know your labs. NCLEX wants you to know complication related to each of those 10 body system and intervention. So sign and symptom, abnormal findings, and what? Intervention, right? Complication of each of those 10 body system and intervention, because you don't just want to know the sign and symptom, abnormal finding, you also need to know the intervention. You don't want to just know the complication, you also want to know the intervention as well too, right? So this is what you uh, want to know, right? That will help you out on the NCLEX exam. So now, if you are answering prioritization questions such as this, right, you will notice that prioritization question is really, because NCLEX is full of 70% of the NCLEX is full of abnormal findings, for crying out loud. So this cover everything you need to know. This is your sources right here. Except if you don't like passing the exam, right? You're going to study all this. Except if you don't like passing the exam, you're going to study all this. But the problem is that a lot of students, it's a lot of work doing all these things by themselves. That's the reason why I created my coaching program for you, so that you don't have to go through all this stress. I've done everything for you. All you just need to do is to join my coaching program, and you have all these things covered for you, right? When you join my coaching program, so you don't have to deal with the stress. You just need to just do the work and be able to answer questions, be ready to pass the exam after taking the exam or finishing the coaching program. Because obviously we are here for results, and you are not here for just taking a program. I definitely will guarantee you that result if you are committed to the process and you do everything right. So 70% of your exam is all about abnormalities. Now, see right here, these are abnormalities, these are abnormalities, these are abnormalities. You can see everything right here, all scream what? Abnormality. But you need to be able to uh, interpret all these abnormalities, because that is what a nurse should do. It's just like right now, if you have a phone, right? And then, um, like you damage the phone and you take the phone to a phone repairer, and you are like, oh, this is what happened after the phone got damaged. It started misbehaving this kind of way. Now you explain how the phone is misbehaving to the phone repairer. Now the phone repairer can now listen to everything you are saying and then feel like, oh, I feel like this is what is happening to your phone, right? And that way, the phone repairer will be able to fix your phone. That is how you should be as a nurse too. Now they are telling you a patient is having this. This is just like you telling the phone repairer the problem with your phone. This is just like you telling the phone repairer the problem with your phone. This is just like you telling the phone repairer the problem with your phone. This is just like you telling the phone repairer the problem with your phone. So what will the phone repairer do with the problem? The phone repairer will listen to your problem, the problem of the phone, and help you fix the phone. Now you are like, wow, my phone is working now. You're able to use it well because the phone repairer understand the problem and was able to fix it. That is how you should be as a nurse. Now, I see a lot of students go on the NCLEX exam. They cannot even fix when a patient is coughing. Some students don't even know what to do if a patient is coughing, for crying out loud. Now, ask yourself, you are watching the video now. Ask yourself, if a patient is coughing, in 10 seconds, think about one intervention that you are going to do. Think about one intervention that you are going to do. Think about one assessment in 10 seconds. If you find out that you are unable to think about a particular intervention related to coughing in 10 seconds, or a particular assessment related to coughing in 10 seconds, it means that you are not ready for the NCLEX exam, because coughing is very common. You need to know. If a patient is having pain, think about a particular intervention or assessment you do in 10 seconds. If in 10 seconds you are unable to think about something, it's a big problem. And you go on the NCLEX exam like this, it means that you are setting yourself up for failure, right? It means that you are setting yourself up for failure. So, as I was saying, right, if a phone repair can listen to your problem, the problem of your phone, and fix the phone for you, that is the same way you, as a nurse, you want to fix patient problem. So you should be able to see a patient problem and be able to think about what is causing it and how to fix it. And this is why all this setup is here for you. Knowing the condition, the 10 body system, head to toe physical assessment, vital sign, labs, complication. Because through all these things, you'll be able to now fix any patient problem on the exam. Now, most students will say, oh, how do I know the condition that is going to be on the exam? You don't need to worry. I have all that covered to you when you covered for you, I mean, when you join my coaching program. Right. The 10 body system, you need to know, I have that covered as well too for you. Right. The 10 body system. The head to toe assessment, I'm going to guide you through the process as well too. Vitals and the normal range, you need to know, I'm going to guide you through that process. Labs, I'm going to guide you through that process. Complication, I'm definitely going to guide you through that process. So you don't need to stress yourself. All you just need to do is join the coaching program. So back to the tutorial. Now, see, now in my mindset now be like, okay, I don't know the condition, right? Because obviously, um the phone repairer don't really know what you did to the phone aside what you are telling the phone repairer. So based on what you are saying, that's what the phone repairer is going to depend on until maybe proven otherwise, right? So now, based on all this presentation, I will be thinking something related to it. So if you don't have the ability to think related to all this presentation, abnormal findings, sign and symptom, whatever you want to call it, then it means that you are not ready for the NCLEX exam. It means that you are not ready to become a nurse. It means that you're going to struggle with the NCLEX exam. Do you want to pass the NCLEX exam in its 5 questions? Right. If you want to pass the NCLEX exam in its 5 questions, I'm giving you the smartest way to study. right? The smartest way to study. If you are doing anything different from this, then it means that you are cramming, you are memorizing, you will be overwhelmed, you will struggle through the process, you will take the exam, you will likely fail, right? Or pass, because obviously it's 50-50, right? It's either you pass or fail. So it's a 50-50. It means that you are gambling the exam. So it's either you pass or fail, because that way, which is that route, don't guarantee you to really pass. It's more leading you to fail. But if you follow a smart way of studying, you will 100% pass. Right. And that's what I'm guiding you through now. You are going to see as it's going to be smart. Now, this is it. Now, if you follow this process, which is this right here, right, which is related to sign and symptom and abnormality, this particular one, and you are looking for, like, now coughing is related to respiratory system, right? So now you've gone to look for sign and symptom and abnormalities related to respiratory system. You will see coughing, most especially productive cough, dry or productive cough. Now, the intervention you need to do, right, will be provided as well too, because you are going to search for the intervention. Now, from there, you are now going to be thinking about is, okay, what caused productive cough? Because at the end of the day, you need to know what caused those abnormalities as well too. What caused those abnormalities? So you are now like, okay, what caused it? Because it's from the what that you can know how to fix it. I repeat, it's from the what that you will know how to fix it. Now, guess what? Look at it. Now I'm like, okay, what caused productive cough? Then I'm like thinking about it. I say, okay, productive cough can be caused related to respiratory problem. You see, I'm like, oh, respiratory problem can cause productive cough. Again, I can start thinking. I can say, oh, what can cause productive cough again? Now, another thing that can cause productive cough can be related to fluid in the lungs, right? Fluid in the lungs. So I'm like, respiratory problem can cause productive cough. Fluid in the lungs can cause productive cough, right? So I'm like, okay, what can cause productive cough again? Another thing that can cause productive cough is bleeding, right? Let us say there's internal bleeding and then the blood has got into the lungs. That's another thing that can cause productive cough. So it means that before I check this condition, is either this condition is related to respiratory problem, is either this condition is related to fluid in the lungs, or this condition is related to bleeding. That is what I'm going to evaluate based on this condition. Now, for anxiousness, what can cause anxiousness? Right? Anxious can Alzheimer's, dementia, mental condition can cause anxiousness, and also low oxygen. Low oxygen can cause anxiousness. So, meaning if I'm going to evaluate anxiousness, it means that this anxiousness should either be related to Alzheimer's, because we've not reviewed the condition right now. Is either the condition should be related to Alzheimer's, related to dementia, or related to mental illness or low oxygen. Right. So let's review the condition now so that we can break it down. Oh, so now you now see, oh, it's heart failure, right? So you are not like, oh, it's heart failure. So now you will say, is this heart failure a respiratory condition? Because we are suspecting respiratory condition, obviously no. So we are ruling out respiratory condition. So now we are now like, is this heart failure related to fluid in the lungs? Yes, heart failure, because I said you need to know the definition and pathophysiology. So heart failure can lead to fluid in the lungs. So we are like, yes, it's related to fluid in the lungs. So fluid in the lungs stand out for heart failure. Now, is heart failure related to bleeding? Obviously, no. So we have been able to rule it out. So we can easily now say the reason why this patient is having productive cough is because they have fluid in the lung. So we've been able to evaluate this productive cough now. Now we want to evaluate anxiousness. Now, is Alzheimer's this? No. Is this dementia? Because we said anxiousness can be caused related to Alzheimer's, dementia, mental illness. This is not Alzheimer's, this is not dementia, this is not mental illness. So our suspect right now will be low oxygen. So we have a patient that is having a condition related to fluid in the lungs and as well to showing sign of low oxygen. So we can easily believe that this patient have what? Low oxygen, and that's why they are having anxiousness, and they have fluid in the lungs, that's why they're having productive cough. Now, if you are to prioritize right now, guess what? You have a perfect way of prioritizing, because for a patient to die, the CNR need to be affected, which is the cardiovascular, neurological, respiratory. Now, this is what a lot of students do. They do ABC, but me, I do CNR. Do you know the reason why? Because ABC is respiratory, so I can say AB for respiratory. But if you are not including neurological system, then you are not prioritizing, because at the end of the day, you need to prioritize ABC and as well the neuro as well too. You cannot separate the neuro. So that's why I'm using CNR, so cardiovascular neuro respiratory. So respiratory can either be airway or breathing. And also, this is how it works. Neuro is on top, cardiovascular and respiratory is below because neuro control these two. If neuro is having problem, cardiovascular is going to have problem, respiratory is going to have problem. Now, neuro is the one that control the body. So if neuro is having problem, trust me, there's a big problem. If cardiovascular is having problem, yes, it can be problematic. Respiratory can be problematic, but cardiovascular need to affect neurological system. Respiratory also need to affect neurological system before there's a big problem. Right. So, but at the end of the day, this three body system is responsible to kill a patient immediately if you don't. Let me not say immediately. Let me just say soon, sooner, let me say sooner than other body system, because we have 10 body system, right? This is what I'm going to teach you when you join the coaching program. I will teach you, because most students always used to say prioritization is all about who will die first, and most students don't even know how to evaluate who's going to die first. I'm going to teach you how to evaluate it, right? It's not strategy, it's understanding, right? You need to understand that this is the three body system that hold human life. If there's problem with any of these body system, that patient will die soon. Right, but if you see problem with GI, endocrine, renal system, these patients will still take time before they will die. It will take time before they will die. They will not die yet. But cardiovascular, neurorespiratory, yes, if you don't attend to them fast, they will die. Now we can evaluate that based on our, because this is what I do, right? This is what I do. Let me show you real quick. I have level to understanding who can die first. Let me put it on the screen. I have level to understanding who can die first. Let me put it on the screen. I have level 1, I have level 2, and I have level 3. Right. So my level 1 is cardiovascular neurorespiratory. My level 2 is GI, endocrine, right? The renal system and immune system. Now level 3 is musculoskeletal, reproductive, and then the skin integumentary. So now this is always your top priority list. Now you are going to look for patient that is experiencing level 1 issue first, right? Not based on the diagnosis. You see, not based on the diagnosis, because I am picking based on what the patient is experiencing. Now when I evaluated this patient is having respiratory problem and neurological problem, and everything all scream low oxygen. So this is going to be my level 1 patient. Right. So based on my evaluation, this is my level 1 patient, right? Because the patient is there's nothing related to all this, so I cannot put it level 2. There's nothing related to all this, so I cannot put it level 2. I'm only using what the patient is experiencing to place them in level, not the diagnosis. Please, not the diagnosis, because that's the mistake. A lot of people think with the diagnosis, which make them emotional thinker, which make them not think like the way NCLEX wanted them to think. So, right. So there's a yeah. If you join my coaching program, I'm going to really put you through. Right. And if you are gaining massive value, because I'm not trying to like keep anything to myself. I'm trying to give you everything, but I don't want the video to be long. These are things that I feel like you should know right from nursing school. So, but if you don't know it, it means I need to go in depth, and it will divert me from the main thing I want to talk right here in this tutorial session. Now, the next part is for me to now evaluate what this other one right here. Now, to evaluate this other one right here. You see, we are not using the diagnosis, and we are able to evaluate. Now, this is abdominal pain. This is diarrhea. Now, let me tell you another mistake a lot of students do. Right. Now, the NCLEX said, who are you going to assess first? The NCLEX did not say, think about each of these conditions and tell us the future problem they will start developing. Right. Now, see, when most students think about cramping abdominal pain and think about diarrhea, right? Do you know what they will start saying? They'll say, oh, a patient that is having diarrhea will be dehydrated, and from dehydration, they will lose electrolyte and they will die. You see, you are adding more problem to the main problem. NCLEX only just told you that this patient is having abdominal pain and they're having diarrhea. And you are adding more problem that the NCLEX did not put in the question. Do you think the NCLEX is stupid? If the NCLEX want to add diarrhea to this question, okay, sorry, I said dehydration, I mean. Let me recap. Right. Let me recap so that I say it right. Now this is it. Now most students, now this is the main problem. But guess what? Most students add more problem to the main problem. Like now they will see diarrhea now. They will start saying, oh, a patient that is diarrhea, we have dehydration, they are going to have low electrolyte. You see? Now you are adding more problem to the main problem. right? Because NCLEX is not stupid. If NCLEX want to add dehydration to this question and add low electrolyte to this question, they will add it. It's just because of this patient has not started experiencing dehydration and they have not started experiencing low electrolyte. That's the reason why it's not part of the question. So why adding problem to existing problem? That's why I say this kind of student, they are emotional thinker. They will think out of the question, bring more problem to the question, and why bringing more problem to the question, it even give them more problem to deal with. Because this is what the NCLEX just want you to deal with. A patient that is having abdominal pain and diarrhea, that is it. They are not telling you that the patient is currently dehydrated. They are not telling you that this patient is currently having uh electrolyte issues. So why thinking about it when it's not part of your question? This emotional thinker, they think out of the question. You don't want to be like that. So currently right now, this patient is only having GI problem because what can cause abdominal pain? If it is pain that NCLEX gave, right, before we say, okay, what's the location? But guess what? The NCLEX has given us the location, so we know it's a GI related pain. Right, and diarrhea as well too is a GI related thing. So now the diarrhea, we need to evaluate it. One thing I wish you to tell my students is this: you see infection, right, and pain, right, you cannot link it to one body system. It's a particular issue that can affect all the 10 body system. So that's the reason why you need to know where all these things are affecting. If it is sepsis, now you can say, oh, sepsis is affecting every body system at a time. But if it's an infection, right, there is no sepsis yet, that infection can either be a neurological related, maybe meningitis, it can be respiratory related, which is pneumonia, or any other thing. If it's pain as well too, you want to know the location as well too, whether it's pain that is related to cardiovascular, respiratory, neuro, just like that, right? So but we have the location already, so we are thinking about GI pain, right? So anything can cause GI pain, right? But at the end of the day, we are just like thinking about GI pain. Now diarrhea, um also it can be due to medication, it can be due to the condition as well too. So abdominal pain, it can be due to condition, right? So diarrhea can be due to medication or the condition. So we are like, okay, if it's medication, let us see. If it's condition, let us see. So now we review the what, and then we are like, oh, this is a GI issue. So yeah, for GI issue, it's expected for them to have all these issue. But we are trying to monitor this patient to find out that these patients are not getting out of hand. For now, this patient is not getting out of hand because this is obviously a GI issue, and these two are not GI related issues. So this patient is still okay in as much this is what they are experiencing: abdominal pain, diarrhea. We have a patient that is having low oxygen, for crying out loud. Number one, this patient is having low oxygen because number one scream what? Low oxygen. So low oxygen over a patient that is having abdominal pain and diarrhea, definitely you are going to prioritize what? Low oxygen. Because remember the level, GI issue is level 2, and then we have this patient to be level 1. So this patient can wait. Right, so we are left with 3 right now. We have petechia, we have heavy menses. Now petechia can be related to 3 things: medication, it can be related to medication, it can be related to condition, it can also be related to fat embolism. Right. So if this information that we have not exposed right here, if it's medication, is a priority. If it is fat embolism, is a priority. But if it's a condition, it's not a priority. Right. If that condition is related to low platelets, it's not a priority. But if it is fat embolism that is causing the petechia, is a priority. If it's medication that is causing the petechia, is a priority. That is that for petechia. We are going to see what we have there. Now for the heavy menses, right? Now in your mindset, you are like, oh, this patient is bleeding. Now you don't know how to prioritize bleeding. That's the problem. Now, in order to prioritize bleeding, right? There are some certain bleeding that we need vital sign in order to evaluate them. Now, physiological type of bleeding such as menses, you need vital sign to evaluate if truly that heavy menses is causing a problem. Now, because this is related to physiological. Now, also related to surgery, bleeding after surgery, right? We expect bleeding after surgery, but in order to evaluate if the bleeding is serious, right? One way we know is vital sign. Two, if it is related to saturated pad, we say, okay, for saturated pad, patient should use one pad, right, for 1 hour. So if you patient is using more than one pad in 1 hour, then the patient is bleeding. Or if it is like a chest tube, right? If it's chest tube, we say 500 mil in 24 hours, right? of bleeding, right, of blood, I mean, right. And if it is vaginal delivery, we say 500 mil, less than 500 mil in 24 hours. Remember, this is less than um 500 mil, right, in 24 hours. If it is C-section, we say 1000 mil in 24 hours, right. So this is how we evaluate bleeding. There are more ways, but I don't want to go in depth because I don't want to like make the videos this session so long. I just want us to focus. But now you get the idea that there are ways you prioritize bleeding. It's just like now a patient that is bleeding from the head and a patient that is bleeding from their IV site, who are you going to prioritize? Obviously the patient that is bleeding from the head, because IV site you can just apply pressure. A patient that is bleeding from the hand, right, and a patient that is bleeding for the head, who are you going to prioritize? Obviously patient that is bleeding from the head, because from the hand is not a critical area, but the head is a critical area. You see, I'm giving you hints, right, so that you know how to prioritize. Now in this case, heavy menses, I already know based on my prior knowledge that you need vital sign to be able to evaluate heavy menses, and there's no vital sign provided here. So it means that the NCLEX is sending us a signal that this patient is stable. So all I need to prioritize right now is related to petechial, because petechial might be the one that might be the problem. But guess what? If NCLEX is already giving heavy menses here, it automatically scream number 3 is not a priority. But let us just like benefit of doubt, right? Because if it's related to condition, is not, if petechial is not a priority. But if petechial is related to medication or fat embolism, it's a priority. So let us see. Oh wow, you see, it's related to condition, so it's not a priority, because this priority, yes, is expected for them to have petechial. But if it is petechial related to medication, we'll prioritize it. If it's related to fat embolism, we'll prioritize it, because medication can cause there are some medication that can induce what, low platelet, because this is low platelet, right. What this means is unknown, idiopathic is unknown, thrombocytopenia is low platelet purpura. Right. So that is it. So this condition is expected, because this is a chronic condition, is expected. It's just that we want to watch out for bleeding. But in this case, this kind of bleeding that is occurring is related to physiological type of bleeding, which is something that every lady do experience. So you cannot just say because the patient is having heavy menses, oh, it's a priority. You start saying it's a priority, then it means you are emotional thinker. You need vital sign to evaluate physiological type of bleeding. Right. You need vital sign to evaluate it. For in this case, NCLEX did not provide those vital sign. It means that NCLEX don't want us to think towards that area. You see how we are able to X2 and 3. Now this one is not saying deep snare with exertion. Now this is even what is making it not a priority. Now let me explain something real quick so that you understand. Let me take this off. Right now, deep snare can occur due to various reasons, right? It can occur due to stress, it can occur due to the way you sleep, it can occur due to how you eat, it can occur due to maybe you are doing a certain stressful activities, exercise, right? Exertion, as we saw right there. Now if you stress, all these things stress the way, if it is stress you need to rest, if it is sleep you need to change position, right? You need to change position. If it is eating you need to eat small frequent meal. That's why we always used to encourage patients who have COPD to eat small frequent meal. If it's activity, you need to rest or reduce your activity. If it is exercise, you need to rest or you don't do vigorous exercise. If it is exertion, you need to rest. You can see all these things are screaming things that are not a priority. Now, guess what? See, let me show you something real quick so you understand. Let me take this off. Now, if NCLEX said this patient is having deep snare, right? And they take this off and they say deep snare and using accessory muscle to breathe. This is going to be a priority. Right. But because they added this exertion, what the NCLEX is trying to send to you, the signal NCLEX is trying to send to you is that, oh, because this dyspnea is caused by exertion, just tell this patient to rest, they are going to be fine. Because we know what is causing the dyspnea. Is that stressful activities that they are doing that is causing that dyspnea. So what we just need to tell this patient to do is to rest. Now, if this patient did not, if this patient rested and the dyspnea is still present, that's when it become a problem. But for now, what this patient need is to rest. They don't need any treatment. They don't need any medication. They just need to rest. So is this exertion that is already telling us that this dyspnea is not a priority? You see, now, but if you are emotional thinker, you say, oh, this patient is having what? COPD. You now say, oh, this patient is having COPD and dyspnea. So because you are thinking about this condition, this dyspnea will make a lot of sense to you as an answer. But if you did not look at the condition initially and you only focus on dyspnea with exertion, The NCLEX is already telling you that this dyspnea is not happening because they have COPD. Instead, this dyspnea is happening because they are doing exertion. All I just need to tell this patient is rest, and then dyspnea will be resolved. The only time it's going to be a priority is if they rested and the dyspnea is not yet resolved, which in most cases it gets resolved. So never use your diagnosis to prioritize. You see the mistake a lot of students do, and you can see this is X, and you're having one, and then one become your answer. You see, now this is how I can help you pass the NCLEX exam, like showing you everything you need to know. And trust me, this is just one of 17 cognitive trap I teach my private students. Right, this is just one of 17. So imagine you join my coaching program. You see what you've learned, right? In few minutes, right? And at the end of the day, you now have the ability to critically think. Now you have the ability not to make this mistake. Imagine you are in my coaching program for the next 60 days, learning everything you need to know. You see, you have the ability to pass the exam, right? And what I just showed you is literally part of my first coaching module, right? Which my student pay $497 to go deep into this, because when you understand how the NCLEX think, you don't study harder, you answer smarter. And now you know why many smart students still fail. Because it's not about being smart. Now, a particular student sent me a message today on WhatsApp. The student said she studied audio content, right? She saw those contents she studied and she failed. Now, I told her there are three reasons why a lot of students fail the exam. Now, let me show you real quick. Now, there are three reasons why a lot of students fail the exam. One is content. Content is just one of them. Knowing how the NCLEX write the question and the ability to understand it. Right. One is the content, knowing how NCLEX write the question and trying to understand it. Now, content is just one of it. Right. You might know the content, but do you know how the NCLEX write the question? Right, because if you don't know how the NCLEX write the question, you will never be able to understand it. So the moment I fix all these things with any student, they always pass the exam. Most especially a particular student who failed the exam 14 times. Right. She said she was struggling with English. Guess what? This is just what I fixed. I told her the NCLEX exam is not all about English. It's all about concept. The moment we can understand the concept related to the exam and fix these three things, you'll be able to pass. She passed on her 15 attempt. Right. And I want same for you. Right. Obviously, so far so good. Most time I always used to say maybe there are some certain students that can pass the exam and there are some that cannot pass. But after this student pass, trust me. After I also have a particular student who faced 7 times as well too. Trust me. And I saw a particular student who failed 85 in 85 question, struggle with understanding where the art is located. She cannot even tell me where the art is located. She don't know where the liver is located. And this student was able to pass because I was scared, because how will she cope with case study? How will she cope with bow tie question? How will she cope with chat question? And she was able to pass. So I've seen a lot of things that already scream or 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 is telling me that it's not difficult to pass. The moment you fix the problem, you'll be able to pass, except if you are not ready to become a nurse, except if you still like struggling, except if you are not ready to do the work. You have the ability to what? To pass. Right? So yeah, this is it, right? As I said, many students who are smart, they still fail the exam, right? Because being smart is not enough, right? You need strategy, you need guidance. That's why I'm ready to coach you. You need guidance, you need pattern recognition, right? You need someone who who have helped what thousands of students pass with confidence, and have helped more than 700 plus pass the NCLEX exam successfully, right? One thing I want to also say is that I'm trying to make a part 2, part 3, part 4 to this, right? Whereby I talk about how NCLEX test evaluation, right? Because this kind of question on the NCLEX exam appear um multiple times, right? This kind of question, how to answer evaluation type question, this kind of question will appear multiple times on the exam. Like for prioritization question we just did right here, this prioritization question can appear more than 10 times on the exam. Now let me show you how the NCLEX work real quick related to passing standard. Now the passing standard for RN is 0.00. So you have this line right here, you have your 85 question, you have this line right here, you have near the passing standard, you have below the passing standard, you have above the passing standard. Right. So now, take for instance, you join my coaching program, you learn everything you need to know related to prioritization. Now you have the ability to get 10 prioritization questions on the exam, right? And score everything. Now imagine you you're on the exam and you pass all your prioritization questions. So this 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Let's also say that's 10, right? I'm just trying to fill up something. Now it will take you to get 11 question wrong to fall near passing standard, right? So if you can score 10 question and get 11 question wrong, then there's a problem because it's not possible. You that have the ability to score 10 question correctly, that same you have the ability to either miss two, get the third one back. You are just going to be going just like this, just like this, just like this, just like this, just like this. You will never fall near the passing standard or below the passing standard. So imagine you know everything you need to know for the exam, you double down on it, and then you're able to like score the most of in those areas, because prioritization is 100% on the exam. You cannot escape it. So if you double down on those areas, right, trust me, you will pass the exam. You'll pass the exam. Now, as I'm saying, right, evaluation question used to show up on the exam 10 plus. Same with prioritization 10 plus. So imagine I give you the ability to answer prioritization, I give you the ability to answer evaluation type question. That is 20. Let us say out of this number, let's be realistic, right? Let us say you just score 15 over 20. Right. This is still a good score that put you above the passing standard, right? Out of 85 questions. You see? Right. 15 will not be scored, by the way. So you have 70 questions. Right. So 15 out of 20 guaranteed question that will be on the exam. That will put you above the passing standard. So that's why I want to talk about how you answer evaluation part 2. So I'm going to name this video part 1, and I'm going to name the other one part 2. So when I'm ready to make that, I'm definitely going to make that tutorial session. Also, most students have been told that when they see a particular answer that they are similar, like let's say they see two answers that are similar, they should eliminate the two answers. This is wrong. This is very wrong. Right, I'm going to do part 3. I'm going to cover this. I'm going to show you different NCLEX past question. Right, what I do on my channel is NCLEX past question. I don't do question banks. Right, I do question related to what have been tested on the exam previously, so that we can start thinking like the examiner. I don't want you to study a particular question bank, you go on the exam and you are not even seeing more than 8 questions related to the question bank on the exam. So what's the essence of expecting your question related to question bank to show up on the exam? And I know most students don't expect their question that they learned related to a particular question bank to show up on the exam. But I'm just saying, many students, there are some students that expect their question bank question to show on the exam. But guess what? Since this is not guaranteed to be on the exam, but there's a pattern that is guaranteed to be on the exam, which is related to the NCLEX past question. So let's focus on the NCLEX past question. So we have that lockdown. We know the pattern and everything, and then we are going to see that same pattern, right, on the NCLEX exam and be able to pass. Now, lastly is SATA. Select or apply. Most students think there's strategy to answer select or apply question, but trust me, there's no strategy. But I can show you how you can be able to answer select or apply question in a way that you are making smart decisions. So I'm going to do this part 4. So yes, that's what I really want to cover. So now I want you to imagine going into the NCLEX not with panic but with peace, knowing exactly how the question are structured, because that is what I'm going to teach you in my coaching program, right? Knowing how to spot a trap answer in just 5 seconds. Most I tell students, you need to just spend 30 seconds on a particular question, because I can see a particular question right now and spot the trap in just 5 seconds. I have the ability, because that is how NCLEX write the question. I've done analysis of over 1,000 NCLEX question, past question, so I know how NCLEX writes the question, right? So I want to give you the ability to know how to think like the test maker, because that is how I think as well too. Now, when I see the question, most especially this part 3, I would tell you why this is wrong. Because if you see two answers that are similar, you can use that to start thinking about what the examiner have in their mind, right? What is the examiner mindset? You can easily know what is the examiner mindset. You only need the examiner question to know what is the right answer. So it's not all the time you need to eliminate. Most especially, this even give you a clue of what the examiner is testing. We are going to get there, right, when I make that session. But guess what? This is something I want to do for you, right? You can decide to do everything yourself, and you can decide to join a structured program that already have everything for you, and then be able to pass after 60 days. My coaching program is for 60 days, right? Also 8 weeks, right? And we are going to be doing uh everything related to the NCLEX. I'll give you the ability to pass. I will teach you everything you need to know for the NCLEX. It's just for 497, right? This is the investment, right? 497, and I'm inviting you to join this if you are truly ready to pass. If you are tired of struggling, right? I want you to right, join my coaching program, right? So yeah, most students decide to pay this in full, right? I have many students that pay this in full, and most students pay using payment plan, right? So payment plan, all you just need to do is to pay $250, right? And then you tell me when you are going to make the order, $250, right? So but yeah, if this is what you want to do, you want result, you don't just want to go through a program, you definitely want to pass, which yes, what I'm ready to give to you is result, right? Because my program is result based program. I need the result. We have the same goal. You want to pass, I want you to pass, because I need the result to motivate other students as well to that they can do it and they can pass. So if that is you, I want you to reach out to me, +1 767 613 0769. So text me right now. You can either text me uh directly, iMessage, or you text me on WhatsApp, right? But do everything to reach out to me, and I'll be able to help you out. +1 767 613 0769. Most students always used to reach out to me and they will be like, oh, I'm unable to add your number on WhatsApp, right? If you add this number on WhatsApp, all you just need to do is to close your WhatsApp application, open it back again, look for my name, and you'll be able to see it. Right, or you need to go directly on WhatsApp. There's a particular area you can add this number directly on WhatsApp. So from there, you can easily chat me directly, or better still, you just text me, right? You text me, and then I'll be able to get your text and add you directly on WhatsApp. So yes, just do everything to yes get this amazing program, and I can guarantee you at the end of this 8 weeks coaching program, you'll be able to pass. So I'm going to see you